Today, we are going to see about heart. Myself, Dr. Divyalakshm, Assistant Professor from Department of Anatomy, Slims Puducherry. The overview of today's topic are, today I'm going to discuss on external features, internal features, and blood supply of heart. Heart is a hollow muscular organ, cone-like shape, which is present in the middle mediastinum. Middle mediastinum is a space present between the left and the right lungs. Heart is enclosed in a covering called pericardium. Heart is compared with that of the blood vessel. Blood vessel has three layers from inner to outer, which is tunica intima, media, and advent tissue. So intima is lined by endothelium. Middle wall is formed by smooth muscle cells and elastic fibers. The outer layer is made up of connective tissue. Similarly, heart also has three layers. The innermost lining is called endocardium, which is lined by endothelial type of epithelial tissue. Middle layer is formed by cardiac myocyte, cardiac muscle. The outermost layer is epicardium, otherwise called visceral layer of serous pericardium, which is lined by mesothelial type of epithelial cells. Human heart is four-chamber structure, consists of left atrium, left ventricle, right atrium, right ventricle. The two atria are separated by interatrial septum. Similarly, two ventricles are separated by interventricular septum. The interventricular septum has two portions. Lower 3/3 is formed by muscular part. The upper 1/3 is formed by membranous part. The atria and ventricles are separated by atrioventricular septum. Within the septum present orifice through which atria communicates with ventricles. The left atria communicates with left ventricle through bicuspid or mitral valve. The right atria communicates with the right ventricle through tricuspid valve. From the right ventricle arises pulmonary trunk that divides into left and right pulmonary artery to carry the blood into the lung for oxygenation. Similarly, from the left ventricle arises aorta, carries the oxygenated blood to all parts of the body. Aorta and the pulmonary trunk consist of semilunar valves. Coming to circulation. Types of circulation present in the human. Blood entering the right atrium via superior and inferior vena cava collects the deoxygenated blood and carries to right ventricle. From right ventricle, blood leaves through pulmonary trunk, through pulmonary artery, enters the lung for oxygenation. After picking up the oxygen, the oxygenated blood enters back into the left atrium through four pulmonary veins. So this circulation starting from right atrium and ending in left atrium consists of pulmonary circulation. After reaching the left atrium, the oxygenated blood reaches the left ventricle through bicuspid valve. From left ventricle, blood is passing through the aorta to all parts of the body. After being utilized, the deoxygenated blood is again collected through the superior and inferior vena cava to reach back the right atrium. So the circulation starting from left atrium and ending to right atrium consists of systemic circulation. Human heart is pyramidal in shape, but the pyramid lies down, with apex pointing towards the left side and base is pointing towards the posterior side. The length of the human heart from apex to base measures about 10 centimeter. The maximum width at the base measures 1 centimeter and it weighs 300 grams in male and about 250 grams in females. Heart external features consist of an apex, the base, four surfaces called sternocostal surface, diaphragmatic surface, left heart surface, right heart surface, and borders, left, right, superior and inferior borders. So heart chambers, how it is seen from the gross. So there are four heart chambers. From anterior view, part of the left atrium, part of the left ventricle, part of the right ventricle, part of the right atrium are seen. From the posterior inferior view, left atrium and anterior right atrium are seen, left ventricle and right ventricles are seen. Coming to apex of the heart. The apex of the heart lies at the level of fifth intercostal space, just medial to the midclavicular line. So this is the apex of the heart formed by left ventricle. The apex beat is felt at the left fifth intercostal space, just medial to the midclavicular line or medial to the nipple line. Nipple line is not consistent, so midclavicular line is taken as reference, or it can be measured from mid-sagittal line 9-inch lateral from the mid-sagittal line. When the heart, left ventricle or right ventricle enlarges, the position of the apex beat changes. Base of the heart is opposite to the apex. This is apex means base lies posteriorly, sandwiched against the chest wall. The posterior inferior view, base of the heart is seen, formed by entire left atrium and right atrium. Four pulmonary veins entering into the left atrium are seen, and the superior vena cava, inferior vena cava entering into the right atrium are seen. The two atria are separated by interatrial septum. Posteriorly, a small groove of the interatrial septum can be seen. Base of the heart is limited above by pulmonary trunk, its branches, left pulmonary artery and right pulmonary artery. Below it is limited by coronary sulcus. This coronary sulcus separates base from the inferior heart surface. Left extent of the base is two superior and inferior left pulmonary veins, and the right extent of the base present between superior and inferior vena cava. This is the interatrial septum group. This is a coronary sinus group. The base of the heart lies against thoracic vertebra number 5 to 8 in standing position. In supine position, it lies against thoracic vertebra 5 to 8, whereas in lying down position, in standing position, it occupies one vertebra low level, that is from T6 to T9. So this is the sternocostal surface, this is the diaphragmatic surface, this is the base of the heart, this is the apex of the heart. So base of the heart is majority formed by left atrium. When the left atrium enlarges, it compresses the esophagus that runs behind the base of the heart. So base, after removal of the heart, the posterior mediastinal structures are seen, where you can see the course of thoracic esophagus. Coming to sternocostal surface is otherwise called anterior surface. This is seen after removal of the anterior part of ribcage and sternum. Sternocostal surface of the heart formed by left ventricle, right ventricle, right atrium. Left ventricle and right ventricle are separated by interventricular septum. Its groove, anterior part of the interventricular septum forms a faint groove here. Similarly, right atrium and right ventricle are separated by right atrioventricular septum. The anterior part of the septum presents faint groove between atrium and ventricle here. Diaphragmatic surface, otherwise called as inferior heart surface, because the heart lies over the diaphragm, it receives this name diaphragmatic surface. Here is the diaphragmatic surface of the heart, formed by left ventricle and right ventricle, separated by posterior part of the interventricular septum, its faint groove. Inferior surface is separated from the base by the coronary sinus groove. Left heart surface is related to the medial surface of the left lung. It is formed entirely by left ventricle. Similarly, right heart surface is related to the medial surface of the right lung. It is related by right atrium. Coming to borders of the heart, there are four borders: left border, right border, superior and inferior borders. These borders are observed from the anterior projection from the sternocostal surface. The left heart border, it is oblique, extends from left auricle to the apex. The right heart border is somewhat straight, extends from right edge of the superior vena cava to the right edge of inferior vena cava openings. The inferior heart is oblique, it extends from right edge of the inferior vena cava opening to the apex of the heart. The inferior heart border consists of a small notch just next to the apex. This notch is called incisiva apicis cordis. The superior heart border is not regular because of the entry and exit of great vessels. Crux of the heart. Crux of the heart is observed in the posterior inferior view. It is present at the junction between base and the inferior heart surface. The crux of the heart denotes the meeting point of the interatrial septum, interventricular septum, and atrioventricular septum posterior aspect. In the chest X-ray, posterior anterior view, the heart borders can be, structures forming the heart borders can be appreciated. So left heart border are formed by aortic arch, otherwise called aortic knuckle, pulmonary trunk, a small window between aortic knuckle and pulmonary trunk, forming aorticopulmonary window, a small portion of left auricle. Below it is formed by entirely left ventricle. Right heart borders are formed by superior vena cava, entire right atrium, and inferior vena cava. Now we will see each chamber's external view of features and internal features. First we will see about right atrium. Right atrium can be observed from the anterior view as well as from the posterior inferior view. Right atrium forms part of the sternocostal surface, the entire right heart surface, and the base, it forms about 1/3. Right atrium receives superior vena cava and inferior vena cava. The right atrium and right ventricle are separated by atrioventricular septum, and it presents here a small groove. Posteriorly, right atrium and left atrium are separated by posterior part of the interatrial septum and its small groove. The right heart border is formed entirely by the right atrium that extends from right edge of the superior vena cava opening to the right edge of the inferior vena cava opening. In the right atrium external aspect, a linear groove extends. from superior vena cava to inferior vena cava. This is called sulcus terminalis. Coming to internal feature of the heart, the right atrium, anterior sternocostal surface, excision is given from in front of the superior vena cava to in front of inferior vena cava along the sulcus terminalis. After opening the anterior wall of the right atrium, what are the features seen? The internal features of right atrium presents two features. Anterior features are rough, formed by primitive atrium. In posterior aspect of the right atrium presents smooth features, which is formed by absorption of venous valve. The rough portion presents a linear elevation called crista terminalis. This corresponds with the outer linear sulcus limitans. From the crista terminalis, so many parallel linear elevation extends towards the anterior aspect of the heart in the form of a comb-like structure, forms musculite pectinatum. Posterior smooth part of the heart presents the following features. The small elevation present in the upper aspect of the interatrial septum called torus aorticus. Torus aorticus swelling is produced by the one of the non-coronary aortic sinus. The interatrial septum presents the following features. It presents a oval depression called fossa ovalis. The fossa ovalis is lined by or limited by anteriorly, superiorly, and posteriorly by semilunar limb called limbus of fossa ovalis. In neonatal period, there exists a communication between left atrium and right atrium through the fossa ovalis. After birth, the communication is occluded. The inferior vena cava present a venous valve. This is called Thebetian valve or wall of inferior vena cava. In front of the opening of the inferior vena cava is another opening called valve of coronary sinus or coronary sinus ostia. This coronary sinus ostia is guarded by Thebetian valve. Valve of IVC is called Eustachian valve. Valve of coronary sinus is called Thebetian valve. So the right atria communicates with right ventricle through tricuspid valve. The region of a small portion just above the tricuspid valve orifice is called isthmus. Similar features of rough portion can also be seen inside the right auricle. Coming to triangle of Koch, this triangle of Koch is bounded by anteriorly septal leaflet of the tricuspid valve, inferiorly by the margin of coronary sinus ostium, and posteriorly by a subendocardial ridge extending from left edge of the inferior vena cava valve to the central fibrous skeleton of the heart called tendon of Todaro. This region is of diagnostic importance because atrioventricular node is present deep to the endocardium in this triangle. Openings into the right atrium. The major openings seen within the right atrium are superior vena cava opening, inferior vena cava opening, opening of coronary sinus, opening of tricuspid orifice, some small veins called venae cardi minimi, anterior cardiac vein, and right marginal vein. These all open into the right atrium. Coming to the external features of right ventricle. Right ventricle can be observed in the anterior view as well as in the posterior inferior view. Right ventricle forms the majority of the sternocostal surface and about one-third of the inferior or diaphragmatic surface of the heart. Right ventricle and left ventricle are separated by faint anterior portion of the interventricular septum's groove. Right ventricle and right atrium are separated by the anterior portion of the atrioventricular septum's groove. After opening the sternocostal surface of the right ventricle, the following features are observed. The right ventricle presents rough inflow path. This is rough inflow path. Inflow path presents three features: bridges, ridges, and pillars. These rough portions are called trabeculae carni. Trabeculae carni are considered as ridges. They are simple linear elevations. Pillars. Pillars are formed by the papillary muscles. Three groups of papillary muscles are seen in the inflow portion. Septal group of papillary muscle attached to the interventricular septum. Anterior group of papillary muscle attached to the sternocostal surface. And posterior group of the papillary muscle, otherwise called inferior group, they are attached to the diaphragmatic surface of the right ventricle. Papillary muscles are attached to the three septal leaflet or three cusp of the tricuspid valve through fine branching corder-like structure called corder tendinae. The three septal leaflets are named based upon the position of attachment. This is anterior septal leaflet attached to the sternocostal surface. This is septal leaflet attached around the interventricular septum, and this is posterior or inferior group of septal leaflet. The rough portion is limited by the supraventricular crust to the smooth portion. What is moderator band? Moderator band is considered as a bridge where the two ends are fixed and the middle portion is elevated. So moderator band is attached from interventricular septum to that of the base of the anterior papillary muscle. The right bundle of his conducting fibers are believed to pass through this moderator band. The moderator band are also believed to prevent overstretching of the heart ventricle during diastole. Coming to the smooth outflow portion. So the supraventricular crust limits the rough inflow from that of smooth outflow. The smooth outflow part below the semilunar valve forms a funnel-like structure called infundibulum. Tricuspid valve complex. So tricuspid valve consists of three leaflets and three group of papillary muscles. This is right atrium above, and this is rough inflow portion of the right ventricle. Three group of papillary muscles are posterior group, septal groups, and anterior groups. Septal groups can be either one prominent or multiple small groups. So this is the interventricular septum which separates the right ventricle and the left ventricle. Interventricular septum has two portions. The majority of the interventricular septum is formed by muscular portion and upper one-third is formed by the membranous portion. This membranous portion of the interventricular septum partly it extends above the attachment of the leaflets. So small part of the membranous portion of the interventricular septum can be seen in the right atria, and a small portion of the membranous part of the interventricular septum can be seen below the attachment of this below the attachment of this leaflets, which is given as dotted line. This is pillars, papillary muscle, papillary muscle tip to leaflets, attached caudate tendon. These are cord-like structure that connects the tip of the papillary muscles to that of the leaflets. This can be attached to the periphery of the leaflets or to the commissures where the adjacent leaflets meets. Coming to left atrium, external features. Left atrium are not observed from the anterior view. Only a small part of the left atrium, left auricle can be seen. Left atrium forms the major portion of the base of the heart. Left atrium and right atrium are separated by the faint posterior part of the interatrial septum's groove. The left atrium receives four pulmonary veins: left superior, left inferior pulmonary veins, right superior, right inferior pulmonary veins. The left atrium is separated from the inferior surface of the heart by the groove for coronary sinus. Left atrium seen from left oblique view, receiving the four pulmonary veins: superior and inferior left pulmonary veins, superior and inferior right pulmonary veins. So after opening the left wall of the left atrium, interatrial septum separating the left atrium and the right atrium are seen. In the interatrial septum, smooth portion, a moon-like fossa is seen called lunate fossa, which is guarded by a semilunar foot. Left atrium also presents a rough portion. The internal feature of the left auricle has same features as that of the right auricle. It consists of trabeculae carni. Coming to left ventricle, similar to right ventricle, left ventricle also consists of rough inflow part and smooth outflow part. The inflow part also consists of bridges, ridges, and pillars. So ridges are the linear elevations. Bridges are the two ends are fixed, whether the middle portion is lifted. And these are the pillars formed by papillary muscles. In left ventricle, there are only two groups of papillary muscles. Anterior group attached to the sternocostal surface and posterior group attached to the diaphragmatic surface or inferior surface. The left valve orifice consists of two leaflets, anterior leaflet and posterior leaflet. Similar to the right ventricle, left ventricle also papillary muscles tip are attached to the leaflets through cord-like structure called cauda tendineae. Smooth motion is formed by the beginning of the aorta. Coming to pericardium, pericardium are coverings of the heart. There are two types of pericardium. One is fibrous pericardium and serous pericardium. Fibrous pericardium is like an open sac. It encloses the entire heart. Above it is open, below the sac is closed. Above the sac is fused with the tunica adventitia of the great vessels that enter and exit the heart. Below the sac is fused to the central dome of the diaphragm. So fibrous layer is like an open sac that encloses the entire heart. Serous pericardium is like a closed balloon into which the heart gets invaginated. So serous layer has two layers in turn. The part of serous layer of pericardium that is attached to the fibrous layer is called parietal layer. The parietal layer reflects near the root of the heart into the surface of the heart. The part of the serous pericardium that is attached to the heart is called visceral pericardium, or which in turn otherwise called as epicardium, the outermost layer of the heart. So the fibrous pericardium is like an open sac where the sac gets merged with the outer tunic of the great vessels of the heart, whereas the serous pericardium is like a closed cavity with two layers, parietal layer attached to the fibrous layer and serous layer, visceral layer attached to the heart. This closed space encloses a cavity called pericardial cavity. Pericardial cavity consists of a thin layer of fluid called pericardial fluid. The average amount of pericardial fluid present within this cavity is about 50 ml. If excess of fluid gets accumulated, it leads to a condition called pericardial effusion. The inflammation of the pericardial serous layer leads to a condition called pericarditis. Coming to pericardial sinus, there are two types of pericardial sinus. One is oblique pericardial sinus and transverse pericardial sinus. The oblique pericardial sinus is seen behind the base of the heart in front of the fibrous layer of pericardium. This is reflection of serous pericardium, visceral and parietal layer. So oblique pericardial sinus is present that can be seen after lifting the heart base. So here entire heart is removed to see the reflection of the oblique pericardial sinus at the base of the heart around the vessels that enters the heart. This is SVC, IVC, right superior pulmonary vein, right inferior pulmonary vein, left superior pulmonary vein, and left inferior pulmonary vein. The reflection of pericardium is such that it forms inverted upside J. The next pericardial sinus is called transverse pericardial sinus. The transverse pericardial sinus is situated between the root of great vessels. The transverse pericardial sinus is believed to form due to the absorption of the dorsal mesocardium that is present between the arterial and venous end of the heart tubes. From the arterial end of the heart tubes are formed aorta and pulmonary trunk. From the venous end of the heart tube are formed vena cava and the pulmonary veins. So this transverse pericardial sinus passes in front of the superior vena cava and behind the aorta and pulmonary trunk. As you can see the finger passing through the transverse pericardial sinus. The same is being shown here. It passes in front of the superior vena cava and behind the aorta and pulmonary trunk. During heart transplantation surgery, a ligature can be passed through the transverse pericardial sinus and till the tubes are inserted into this aorta and pulmonary trunk. This ligature maintains stasis for some time. Till the heart-lung machines are connected, this ligature can be passed around this transverse pericardial sinus. After tubes are being fit, ligature can be tied around this tubes. Heart valves. This image shows after removal of the great vessels and the base of the heart formed by left atrium and right atrium. We can see the great valves are placed at exactly vertical position. So here anteriorly pulmonary trunk guarded by pulmonary valves, middle aorta guarded by aortic valves. This side left atrium and ventricles are communicated through bicuspid valve. Here right atrium and right ventricles are communicated through tricuspid orifice. The bicuspid valve consists of two leaflets, anterior and posterior or inferior. The tricuspid valve has anterior, septal, and posterior or inferior leaflets. One can also see the papillary muscles arising from the ventricles and the tip of the papillary muscles being connected to the leaflets through caudate tendon. This is during diastole of the heart where the blood from atria enters into the ventricles. This time, the pulmonary and aorta valves are closed. This is during systole of the heart where the blood leaves the ventricles through pulmonary and aorta where the bicuspid and tricuspid valves are closed. The pulmonary valves has three cusps forming three sinus or pockets. Pulmonary valve has one anterior and two posterior sinus, whereas the aortic valve has two anterior and one posterior aortic sinuses. From the left aortic sinus, anterior, left coronary artery arises. From the right anterior sinus, right coronary artery arises. So the posterior one does not give rise to any coronary arteries. So this is called as non-coronary sinus. Left anterior, right anterior, non-coronary sinus. So one of the aortic valve is excised to observe the aortic sinuses and features. These are the sinus or pockets. These are the cusp. The center region of the cusp presents a fibrous nodule called body of Arantes. From the center of the nodule, the free edge presents a moon-like elevations called lunule. The region where the cusps are attached are called commissures. So from the left anterior aortic sinus arises left coronary artery. This is the osteo for left coronary artery. From the right aortic sinus arises right coronary artery and its osteo. Here one can see the interventricular septum, muscular portion and the membranous portion. During diastole, all the nodule of the aortic cusp and the pulmonary cusp comes in contact with each other with its lunule. Coming to blood supply of the heart, let's see about arterial supply. First about right coronary artery. Coronary arteries are considered as vasovasorum. Vasovasorum generally they are the blood vessels that supply the outer portion of the blood vessels, thick blood vessels. Similarly, since heart is considered as a blood vessel, the artery which supplies the heart is also considered as uh, coronary arteries are also called vasa vasorum. First, we will see about right coronary artery. The right coronary artery arises from the right anterior aortic sinus. After arising, it passes between the left auricle and the right ventricle in the anterior aspect of the atrioventricular group. It runs up to the heart's inferior border. After reaching the inferior border, the right coronary artery runs along the groove for coronary sinus between the right atria and the right ventricle. Here it gives branches that is seen within the groove for posterior part of the interventricular septum. After which it communicates or anastomosis with the branches arising from the left coronary artery. This is a course of right coronary artery. The branches arising from the right coronary arteries are right coronary artery gives a right conus artery. The right conus artery supplies area of infundibulum in front of the pulmonary trunk. Apart from that, from the right coronary artery, so many atrial branches arises that supply the atrium, and so many anterior ventricular branches arises that supplies the sternocostal surface of right ventricle. One of the largest branch of the anterior ventricular artery is called right marginal artery. The right marginal artery runs along the inferior heart surface. Among the many atrial branches, one of the atrial branches passes between the superior vena cava and aorta, winds around the superior vena cava, and supplies the SA node present in front of the opening of superior vena cava. Other branches are posterior interventricular artery, which is given in this group for posterior aspect of the interventricular septum. So, to summarize, right coronary artery arises from the right anterior aortic sinus. It runs between right auricle and right ventricle in the anterior aspect of the atrioventricular septum's groove. After reaching the inferior heart border, it runs between the right atrium and the right ventricle within the groove for coronary sinus. The first branch that gives is called right conus artery. The right conus artery supplies area of infundibulum in the sternocostal surface. It gives so many atrial branches. One of the atrial branches supply the SAV. It gives so many anterior ventricular branches that supplies the anterior surface or sternocostal surface of the right ventricle. The largest artery is called martial artery that is runs in the inferior heart border. Behind, it gives so many posterior ventricular branches that supply the inferior surface of the heart, right ventricle. And here in this group, it gives posterior interventricular arteries. Coming to left coronary artery arises from the left anterior aortic sinus. After arising, it passes behind the pulmonary trunk. It runs for only a short distance. Immediately, it divides into two branches. The anterior interventricular artery, it runs in the anterior groove of the interventricular septum. The next artery is called left circumflex artery. It winds around the left heart border and appears in the groove for coronary sinus. What are the branches that are arising from the left coronary artery? No branches arises from the stem of the left coronary artery. From the left anterior interventricular artery, otherwise called anterior descending artery, arises left conus artery. The left conus artery supplies the region in front of the infundibulum. So the right conus and the left conus anastomose in front of the infundibulum and forms a ring-like structure called annulus of Vucins. This anterior interventricular artery also gives so many ventricular branches that supply the anterior aspect of right ventricle and left ventricle. The left circumflex artery gives left marginal artery, left diagonal artery. Left circumflex artery, after passing through the coronary sulcus, gives so many atrial branch that supply the base of the heart formed by left atrium, so many ventricular branch that supply the inferior portion of the inferior surface of the left ventricle. The left circumflex and the right coronary artery anastomose here. To summarize, left coronary artery gives left conus artery, anterior interventricular artery, otherwise called anterior descending artery, circumflex artery, it also gives marginal artery. Diagonal artery may arise from the circumflex artery or sometimes arise directly from the trunk. It gives so many atrial and ventricular branches on the inferior surface of the heart. Coronary dominance. What is coronary dominance? When the posterior interventricular artery arises from right coronary artery, the heart is called right dominance. Sometimes the posterior interventricular artery may arise from the left circumflex. In that condition, the dominance is called left heart dominance, left coronary dominance. So the specialty of the anterior interventricular artery is the anterior interventricular artery, otherwise called anterior descending artery. It winds around the heart inferior border near this apices incisura cordis and runs behind in the posterior part of the interventricular groove where it anastomoses with the posterior interventricular artery. Coming to venous drainage of the heart. In the anterior interventricular groove begins great cardiac vein. This is anterior interventricular groove. Great cardiac veins begins here along with the anterior interventricular artery or anterior descending artery. This great cardiac vein drains the sternocostal surface of the heart. Great cardiac vein runs, loops around the left heart border and ends there. From the left end of the left heart border begins coronary sinus. This is the large vein. It lies in the coronary sinus where it opens into the interior of right atrium. The oristium or orifice is guarded by the Bayesian valve. What are the tributaries of the coronary sinus? The sternocostal surface, inferior heart border, presents right marginal vein. Right marginal vein winds around the right heart border, continues a small cardiac vein behind, and it drains into the coronary sinus just before the opening of coronary sinus into the right atrium. The sternocostal surface of the right ventricle and right atrium are drained by numerous small veins called anterior cardiac veins. These anterior cardiac veins drain directly into the interior of right atrium. Posterior surface of the heart or inferior diaphragmatic surface, small left marginal vein is present that drains into the left end of the coronary sinus. Apart from that, posterior vein of the left ventricle drains the posterior aspect of the left ventricle that also drains into the coronary sinus. A small vein drains the left atrium called oblique vein of left atrium, enters into the coronary sinus. And the last, middle cardiac vein, this is present in the posterior groove for the interventricular septum along with the posterior interventricular artery. So posterior, this middle cardiac vein and the marginal vein, they open into the coronary ostium just before it opens into the right atrium. To summarize, venous drainage of the heart, the anterior interventricular groove present great cardiac vein. The great cardiac vein runs along with the left anterior descending or anterior interventricular artery. It reaches the left heart border and ends there. The coronary sinus begins from the left heart border, runs in the groove for coronary sinus, and opens into the interior of right atrium. The following are the tributaries of coronary sinus. They are left marginal vein, oblique vein of left atrium, middle cardiac vein, posterior vein of left ventricle, right marginal vein, small cardiac vein. Some veins directly open into the right atrium. They are anterior cardiac veins. Apart from these small cardiac veins and the anterior cardinal veins, There are numerous small veins called vena cardis minimorum that opens into the interatrial septum. Dextrocardia. What is dextrocardia? The normal human heart apex is pointed towards the left, and arching of aorta occurs towards the left side. In dextrocardia, the anterior position and the course of the great vessels starts from the right side. This is the developmental anomaly. During establishment of left and right axis, there occurs some defect. So the entire left viscera, like spleen, they will occupy the right side of the body. The right side viscera, like liver, they will occupy the left side of the body. Same happens with the heart. The left normally directed apex now direct towards the right side, and the entire course of the great vessels are also interchanged. This produces no serious effect. Baby will develop normally, child will live its life normally. And this is occasionally detected when the child contacts the physician. The left apex beat, instead of normal in place, it can be detected on the right side. Myocardial infarction, commonly called as heart attack. It occurs due to blockage of the coronary arteries. So the area of the heart distal to the blockage suffers from lack of oxygen, undergo ischemia. If it persists for long duration, the heart muscles die, they undergo necrosis. This produces severe chest pain and patient collapse immediately. This heart block can occur more commonly in the anterior interventricular artery or anterior descending artery. It can also occur in the right coronary artery, and the third percentage, less percentage can occur in the left circumflex artery. How it can be treated? It can be treated by coronary bypass surgery. Coronary bypass surgery means a venous graft is taken from the lower limb venous vessels, either from short saphenous or long saphenous tributaries or main branch. Then the bypass is done from trunk of aorta to the distal end of the site of the occlusion. So here you can see one bypass done to bypass the blood from this obstruction in the left anterior descending or left anterior interventricular artery. Here, same way, obstruction is present in the right coronary artery and the bypass is done surpassing this obstruction from the trunk of the aorta to the distal end of the site of obstruction. Thank you.